What is the greatest Canadian contribution to medicine?
I think probably universal health care. I mean, I think that the idea that people can get health care and that they don't die of preventable diseases. I mean, look, I'm an American doctor, but I think we'll look back on 30, 40 years from now on this chapter and say, so you did so many things right, yet people still died that didn't need to. Yeah. That was an embarrassing chapter. And so I think, you look at Tommy Douglas, you look at what, the average person has. They don't worry about going bankrupt. It's an incredible contribution.
What do you think with the shift towards President Obama, especially with what's being called Obamacare? It's usually said with derision, and I'm not making a judgment either way on the plan, but just what's happening with the president there, because I know Hillary was trying to do this as well with some kind of health care plan.
Yeah, and I think her plan was in many ways in '94 more aggressive. It was a truly sort of universal health plan that had a single payer component to it. And I worked for the Clinton administration. I worked on health care. I wrote for The Economist for some time on these issues. And so much of it is that, look, I think that if you poll the average person, they'll say, I think universal health care is a good idea. People should have health care insurance. Now, whether it should be, a single payer, whether it should be government, those are worthy discussions to have. But I think what's happened now is you've created an employer-based health care system in the United States that in order to change it, it would be like trying to change the parts on a fast-moving train. And people just, they don't have the patience for it and what happens during that whole transformation. So I think that drives a lot of the sentiment against it. Also, there is a continued distrust of big government, I think, much more so in the United States than a lot of other countries. I think that drives it as well.